No, it's very important early on that you develop a dialogue with your patient, so that you know, because their needs change, what they want changes. You know, what they wanted initially may be very general compared to what they did once they realize the things that they're able to do. That frequently ramps up what their expectation becomes. And yeah, I think that it's just, again, it's incumbent on the practitioners to have this dialogue regularly with their patients to keep abreast of what their needs or what their wants are. That's one of those funny things, like, yeah, I always have to separate needs from wants. But wants actually are more important because we want all of our patients to have tremendous experience every time they come. So if it's something that's within our power to do, we like to deliver it for them. So yeah, there's not a whole lot, truthfully not a whole lot of things that they ask us for that we can't give them. So. Truthfully, the biggest challenge is that they're, and this is really more of a researchy or a proof of things that you do. It's very difficult to measure within that rigorous scientific measurement scale of the impact that you're able to give. If it's because there's sensors involved or something inside a socket, the ability to duplicate that almost exactly every time you did it, like if you did it for me or I did it for you, you'd want that to be duplicated exactly to be scientifically reliable. The problem is when you put it inside a socket, whether it's on the arm or the leg or whatever, you know, the body sweats, those things can move, so you get slightly different readings. So the reliability of some of the data is a little bit questionable. And we tend to go with what is considered anecdotal information. So we always believe that whatever the patient is telling us is the most important thing for treating that patient. The unfortunate thing, and the thing that's frustrating, is that that which is anecdotal is not accepted, and by and large, by the scientific or the medical community, because they want it to be reproducible and to have a very similar result time after time after time for the same patient or any group of patients that are similar. So that's probably the biggest frustration, is that you think you're doing really great stuff, and the patients are telling you you're doing really great stuff. You just have a hard time really scientifically proving what the great stuff is that you're doing. Yeah, so the Warrior Games were here 2 months ago, yeah. So again, a normal civilian situation, you know, a prosthetist or a doctor, whatever, they're not going to go out there to watch. But we would send somebody down to kind of maximize, optimize a setup for somebody. You know, in the trials I was able to run 12.7, and I can't get over 12. I can't get under 13. Something with the prosthetic. Well, it's not always the prosthetic, but you know, sometimes you send somebody out to look at it, and it's like, oh my goodness, you need to change your alignment a little bit. You know, it's amazing sometimes what a degree of dorsiflexion or a degree of plantar flexion, or changing alignment a little bit will make a big difference in being able to perform. So Warrior Games was a good example of where instead of making the patient come to the providers go to the patient. So through professional observation during their event and the anecdotal information that we get back from the patient, we're able to tweak and realign or make little changes to the prosthetic to maximize or optimize their performance during their events. The practitioners here routinely during the business day will go to an ice rink, Rockville, Laurel, whatever, to instead of just handing a device to somebody, to go out and actually work with the patient to make sure that the device is optimized for the way that they're skating or the way that they're running or whatever the case.